And welcome to the show. Subscribe at kevinmd.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Moksha Patel. He's an internal medicine physician. Today's Kevin MD article is How Photography Made Me a Better Doctor. Moksha, welcome to the show.
Thanks, Kevin. Thanks for your work and for sharing our stories every day.
All right, so let's start by briefly sharing your story and journey.
Yeah, so my story and journey is long and winding, to be honest, but I'll give you the one-liner. I actually have severe OCD and have had it since I was a child, which ultimately required brain surgery to fix and treat. But while there are several podcast episodes about that out there, the reason I bring it up is it really shaped my interest in psychology, which shaped me to lead to my journey to medicine eventually. As an undergrad, when I studied psychology, I studied under a professor called Dean Simonton, whose area of expertise was creativity and genius. And he didn't care what field the person was a genius in. He just wanted the understand that the person was a genius and what made them that. And at that time, I became fascinated by how we could take lessons from one field and move them to another field. And that's ultimately what inspired this article about how photography and just passion in photography could lead me to hone my skills in medicine, this kind of cross-training philosophy. Well, fast forward many years and many steps on the journey, I fell in love with internal medicine. I'm now an assistant professor of hospital medicine at the University of Colorado, and I wear a lot of non-clinical hats. I do some clinical informatics and do some assistant director of mentorship OCD program. And recently, to try to explore outside of medicine, I actually created my own mobile game online called Outwit AI to try to learn about skills in computer programming and how those can translate over to clinical medicine.
All right, wonderful. And I think medicine is one of those fields where there are so many interdisciplinary intersections. And I've talked to so many physicians on this podcast. They've written, of course, on Kevin MD, and it's so fascinating to learn some of their skills outside of the exam room or outside the hospital.
Totally. Yeah. No, I feel like the art is long and the life is short, and the only way to perfect it is to constantly, deliberately practice.
All right. So you're going to talk specifically about how photography made me a better doctor. For those who didn't get a chance to read your article, tell us what it's about.
Yeah, so I started taking photography in high school as one of our required classes. And at that time, they teach you a little bit about a few elements of taking a good picture. And some of the things, as I was doing clinical reasoning and cognitive reasoning in the clinical space, I've really noticed some similarities. One of the major ones being your focus. What you focus on, which objective data or subjective data you focus on can really change your entire problem representation and your one-liner. Zooming in and out, like sometimes as a intern, I remember getting caught up in details, and then I would have a more experienced attending or resident come in and say, like, hey, let's zoom out for a second. What is our big picture thing here? This person is 90 years old, has end-stage cancer. You're worried about their sodium being 133. Is that really that important right now? Or are we worried about, goals of care, et cetera? And so that zoom feature in photography.
Mhm.
And then my favorite one is the kind of nebulous flash is, we add flash to a picture whenever it's dark and you need to add some light to it. And I have learned to add flash to everyday interactions with patients, especially when they come in with something quote unquote mundane like COPD or asthma that I've seen thousands of times, and try to connect with them on a personal level to try to make this a little bit more of a human interaction than just a, clinical interaction.
So tell us a story where you added that flash. So like you said, you are a hospital medicine physician, and I'm sure you're very busy and have all these metrics to meet, notes to write, and sometimes that takes away from that personal interaction that you have with patients in a hospital. Tell us a story and an example where you connected with that patient and added that proverbial flash.
Oh yeah, I'd love to. So I was on service a couple of weeks ago, and we had a patient come in. She was very young, 20s, mid 20s, come in with weeks of weight loss, fevers, chills, erythroderma, and also skin breakdown with staph bacteremia, and ended up having newly diagnosed lymphoma. So she was understandably very anxious. So I spent some time and just tried to go through. I actually created a mnemonic for this. It's called color. Add color to my workday. So C is for connection. So I asked her some questions about the type of music she likes, the type of dog she has, those kinds of things. The first O is gratitude, so trying to be grateful for things in my life as well as for my colleagues' lives. The other L stands for laughter, so I try to have scheduled laughter at some time during the day and do jokes with my team. The other O is ooh for curiosity, and I got very curious with her case and thinking about causes of erythroderma. And then R is relax and taking scheduled breaks. So with her specifically, that connection came with talking about dogs, which is always a great topic.
Mhm.
My dog, who is no longer with us, but also her four dogs. And we connected bond based off of that. And I think she really trusted me a lot more after that encounter than before.
No, I think that as hospital physicians, you're always pressed for time. How do you find that time to balance maintaining or establishing that personal connection with everything else that you have to do clinically?
Yeah, that's a great question. And I'll be honest, it doesn't take as much time as I thought it would. It can be a simple question of like, oh, what type of music do you like? Or what type of foods do you like? And the person completely changes their perspective from, oh, this person only cares about whether I'm having bowel movements and my pain to, oh, this person cares about me as a human. So it really only took me 20 to 30 seconds to talk to her about dogs and which breeds of dogs she had. And then we moved on with things, and it did not really add a whole lot of time to my day.
So I want to get back to that concept of zooming out that you had mentioned earlier. And I honestly think that skill of zooming out and picking out what's important from what's less important at time really is the mark of an experienced clinician versus someone just starting out. So let's say you have medical students and residents and interns rounding with you, and they're confronted with a fire hose of information. How do you teach them to zoom out? How do you get them to focus on what's important when they're overwhelmed with all this data about a specific patient?
Yeah, I have two techniques that I have stolen from other people, so I'll give them credit. One was my co-resident Byron Crow, who I went to residency with. He's a hospitalist now as well, but he would always put things into buckets of what needs to happen right now, what needs to happen by the end of the day, and what needs to happen before discharge. And so thinking of things in those types of buckets of which of these problems need to be addressed right now, within the next few hours, and which needs to be addressed in the next few days, is one helpful technique. And then the other one, I tell people I do a lot of nights. And so when I'm cross covering on nights, I ask the students, if you showed up to a rapid response at this patient's bedside, what is the bare essentials that you want to know so you can make educated decisions without knowing, all of the excessive things
Mhm.
about smaller things. So what is when you show up at that room, what do you want to know so you can have clinical judgment as to how to approach this patient?
Oh, fantastic advice. So it's been decades since I've stepped foot in a hospital doing clinical rounds. I'm an internal medicine primary care physician. We have hospitalists like yourself take care of inpatients. How has hospital medicine evolved over the last 5, 10 years or so? Tell us about some of the challenges that you guys are facing today.
Yeah, challenges and I'd say also opportunities. I think one of the major challenges has been just, sometimes in hospital medicine, we are tasked, as you guys are in primary care as well, to fix society's biggest issues. A lot of social determinants of health in the last 5 to 10 years, I think, with people not being able to care for their wounds because they're unhoused, things that our system is not frankly set up to really combat. So you have these people who stay in the hospital for 90 days, 100 days, because we're trying to figure out a safe disposition plan. And oftentimes there is not an ideal disposition plan the way society is set up. That is one of the biggest challenges I foresee in trying to work and how do we coordinate with society and governmental infrastructure to help people get, the care they need outside of the hospital. But I will say COVID, it was one of the very challenging times for us as we were kind of, right there on the front
Mhm.
lines with a lot of illness and death, quite frankly. And what I learned though was that hospital medicine is really cool and you get to be at the forefront of basically everything.
Mhm.
Like you can kind of we started doing more critical care during COVID. once the critical care needs stepped down, we started doing more floor patients. We can do administrative stuff. We can do QI, informatics. The list is endless. So I feel like hospital medicine, just by nature of being on the forefront and kind of your Gemba or Gemba, I forget how to say it in QI words, is kind of walking the walk.
Mhm.
And so I feel like it's a very helpful place to be.
So tell us about more about your photography background and how is that important, not only in terms of influencing how you practice medicine, but as a creative outlet to have a passion outside of clinical medicine.
Yeah, I love that question because I think anytime you can create a passion outside of medicine, it helps with that sea of the color, the connection with people. But it also helps just hone your skills and deal with things like burnout and other things. So for me, I just got back from a trip to London to visit my grandma for her 90th birthday. And London is a beautiful city.
Mhm.
And so lots of amazing architecture to take photography of. And you started noticing like, hey, if I take this picture at this angle, the reflection of this building will shine on this building, and you just see things a little bit differently. And I am by no means a pro photographer or very talented at it, but that has been really quite fun to just explore and, like you said, have a creative outlet.
So, what about your other physician colleagues? Do you see them having creative outlets outside of clinical medicine as well?
I do. I have a couple friends who are actually much more skilled photographers than me, and they actually sell some of their photography work. I have another colleague who is a storms chaser and actually chases storms and takes pictures and does an amazing job there. One of my other colleagues who just joined our group is learning to play the piano and is pretty good at it. And so there's a lot of the arts there. I'm sure there are people who do other, more scientific things. We're in Colorado, so everyone practically is an outdoorsy hiker, skier, snowboarder. You pick it. I really am not, to be honest, but so there's a lot of exploring that way too. And I feel like it's been such a good cultural thing for me to have a place that's well balanced with different diversity of talents and diversity of interests.
So, what about in medical students and residents? Because they've just been working and studying all the time. And are you seeing that they're having that balance as well and trying to balance what they're doing clinically and passing all these boards and shelf exams with something outside of clinical medicine? What are you seeing from kind of our younger cohorts?
I think it's getting better than, from what I imagine it was 20, 30 years ago, because I think schools are recognizing the importance of this kind of well-rounded clinicians. And so the reason I just did a podcast episode with one of the first year medical students who just started her own podcast. And so she's now exploring how to be a podcast interviewer. We were the first episode, so we'll see how it goes. But, I think she had this passion and she wanted to explore it. So I'm seeing that medical students, I think more than at least when I went to training 7 years ago at Northwestern, I think there's a little bit more interest in balancing other things. And I think definitely more than maybe if you go back 20, 30 years.
We are talking to Moksha Patel. He's an internal medicine physician. Today's KevinMD article is How Photography Made Me a Better Doctor. Moksha, as always, will end with some of your take home messages that you want to leave with the KevinMD audience.
Yeah, I think my biggest take home audience for the audience is, don't underestimate the power of your personal passions in making you a better doctor, because those personal passions and interests, you can learn things that will make you a better clinician and help you better connect with your patients. And whatever that passion is, whether that's, creating AI generated art or creating painting or writing poetry, there's a lot to be learned from these different fields and bring back to our field, which is a phenomenal field to be in.
Moksha, thank you so much for sharing your perspective and insight. And thanks again for coming on the show.
Thanks, Kevin.